Good afternoon, everybody, and a warm welcome to this webinar as part of the Ask About Asthma series 2023. Today we're going to be talking about new and old inhaled toxins with children and asthma. I'm Jonathan Grigg. I'm an academic paediatrician based at the Royal London Hospital, where I do clinical work, and at Queen Mary University of London, where I do most of my research. I'm very happy to have introduced our two other speakers. We have Joe Harrison from Global Action Plan, who have been a major player in developing important information on air pollution for dissemination, and Ian Mudway, who's in Imperial, a senior lecturer, an Imperial and visiting professor, whose expertise ranges from modeling to epidemiology, but also to understanding the mechanisms about how air pollution causes effects in children. Could I have the next slide, please? So there's just some housekeepings. You're all muted, so please use the chat feature to ask your questions. The team here will be monitoring those and sending them to us, and we'll be discussing those questions at the end. We have about 15 minutes to talk about that. And this session is being recorded, and there'll be a link later on to the webinar, so you can share that. I think then next slide. Yes, these are our speakers, and this is the, we have about 15 minutes each, and so we have 15 minutes to discuss. So I'm going to share my screen, so just wait a second, and you'll be able to hopefully see that. I'm assuming you all can. So I just have to wait a moment before I can advance the slides. Okay, so as many of you may know, the key, if you like, players in the toxic mix that children and adults in most of our urban areas are breathing include particulate matter, PM by short, oxides of nitrogen, especially nitrogen dioxide, and then on the occasional sunny day, sun acts on those nitrogen oxides and produces ozone. As yet, not a major issue in the UK, although with climate change it probably will be. Now, if air pollution, traditionally the old-fashioned air pollution you could see, this is a road in London, one of the polluted roads in London. As you can see, it looks clear. If you walk down the street, you won't actually probably notice very much, except perhaps the smell of exhaust occasionally from diesel exhaust. And one suspects that if air pollution really looked like this, which actually it does in terms of when we measure it, we would have done things differently in terms of policy and done something about it. And certainly the purpose of this seminar and the webinar is to give you the tools and thinking about ways that you can influence exposure, reduce the exposure of people in your local area. This is an electron micrograph, so it's very, very it's magnified of the particles, the sooty particles that have come from the combustion of fossil fuels. And yeah, each of these little round things here, or appearing round things, are nanometer scale, so incredibly small, and they actually form aggregates. They move together, stick together, but even those lumps of nanoparticles are very small, and if they're less than 10 microns, many of them are less than 10 microns in size, that can mean that they can overcome the normal filtering mechanisms in the nose and the throat and actually get deep into the lung and right to where the air and blood exist and where air transfer happens in the lung. Traditionally, we think of these particles as a carbon, and onto which a variety of toxins are stuck, and as those particles stick in lung tissue, those toxins sort of move off and can cause their effects. But in fact, when we look at the particles in a little bit more detail, we see it's differently. the particles that if we just sample by the roadside or in urban areas, the vast majority of these particles are from road traffic, and that shows you the need for us to alter the emissions from this. But there are other industrial and non-industrial sources as well, which we shouldn't forget about. When we sample those particles, you can see on the left side, one of our sampling machines which collects the PM10 in a little container. You see on the right, it's jet black material. So these are tiny, really sooty particles, and we use those in our models, our cell models, to look at the potential for toxic effects. This is the imaging if you use sophisticated imaging, and this is using scanning electron micrography. What you see is not round smooth particles, but particles here. If you look at the lower level here, they look like the Alps. They're really jagged edges, and those jagged edges almost certainly contribute to the toxic potential. They can deliver more oxidative stress. They may even use that to penetrate cells. We can see these particles in real life and exposure to them, because you can't see them without technology, using, for example, this handheld device up here on the left panel. This measures the amount of black particles, and on the lower panel we see a typical profile of a child who's wearing one of these devices, measuring black carbon particles. And as you can see, the exposure peaks exactly when you expect them, when the child was out playing, and that school was right next to a main road, so there was a peak of exposure, and journeying from home. But interesting enough, there was a peak during breakfast, and emphasizing the importance of indoor air sources as well as outdoor air sources, and we'll talk about that a bit later on. We can see also the particles actually accumulating in the lung using something called induced sputum, and this is a boy who's doing this technique, and basically encourages the cells that are moving up from deep inside the lung to the throat, where we would normally just swallow them, to actually cough those up so we can look at them. So it's breathing a salty mist, and the cells that we're interested in are these sort of round cells, and they're designed to pick up any material that is coming deep into the lung. And you can see that these cells are actually quite heavily laden with carbon, and we can measure the amount of carbon using techniques, with sort of image analysis techniques. And what some time ago we showed that even in a healthy children living in an urban area in the Midlands, East Midlands, that the higher the amount of carbon in those cells that we could measure, the lower their lung function was. And their lung function in this case was FEV1, which just means the amount of air you can breathe out in 1 second in a forced way. And really that shows you the potential of these particles to alter lung growth. Particles, the very small particles, almost certainly move across into the blood. We recently looked at a similar cell from a human placenta, or placentas from healthy women giving birth and who donated their placentas, and we could see these lumps of carbon material, which we, using other sophisticated analysis, could show that they are actually combustion. So the point is that as we breathe these particles, we're getting particles moving around to all organs, and that's one of the reasons why it has potential for a lot of effects outside the lung itself. In terms of lung growth and lung function growth, we've seen suppression of lung function, so that lung function normally increases as the lungs get bigger. And we've seen that even within London, in this study here, we've looked at children within the east part of London. You can see the Thames there, and these are the sort of areas that we've studied. The yellow is a pollution map, and that's quite high levels of nitrogen dioxide pollution and very high levels along roads. What we found was that for nitrogen dioxide exposure, reductions in lung function in children living and going to school in different areas. And this is compatible with what others have shown. But what it does tell us that even relatively small differences in exposure can drive alterations in your lung potential. And the positive thing is that that means that if we reduce levels, not necessarily down to zero, we can actually make a difference in children's lung health. You might say, why am I talking about nitrogen dioxide where I'm talking about particles? We use really nitrogen dioxide as a marker of the traffic-derived mix, of which many of that is particles. But nitrogen dioxide itself, of course, has some toxic effect. In Leicester, one of the very first studies I did was taking a cohort, a group of children, infants, and following them through and looking for the development of wheezing and coughing without a cold, so bronchitis, and then overlaid the Leicester pollution map at that time to those findings. And what we found, this is showing that there was an independent effect of exposure of particles and the development of cough without a cold and wheeze. And basically, this is sort of like 62% increased versus 42% increased risk, adjusted for other things such as smoking in the home. And others have shown that. So development of preschool wheezing certainly associated with air pollution, but also for school-age asthma, and this is from Lancet Planetary Health, showing millions attributable traffic-related pollution, excuse me. We have to mention Ella, and with air pollution exposure associated with her tragic death. And of course, we're seeing, and this is a list of all the potential things that air pollution can do, and this is probably even longer. Maybe as a result of these particles moving around the body, but many, many organs affected. In terms of climate change, we have going to have more infections, including with this bug called the pneumococcus. This is, for those who know epidemiology, this shows that exposure to air pollution is associated with an increased risk of developing pneumonia, including pneumococcal pneumonia in children. And we've done lots of studies looking at the infection of airway cells growing in culture and shown that particles exposure increases the stickiness of the cells, of the airway cells, and in enhancing infection. But we shouldn't forget about other sources. The London Underground particles here, black, but that's due to mainly iron. And yeah, in terms of then translation, if you like, what have we got? We're going to hear from Global Action Plan and Ian about options. I would recommend this in terms of a nice review of the health effects. This is the Every Breath We Take report from the Royal College of Physicians. You can download that free if you go to the Royal College of Physicians website. And this is the infographics that we have focusing on effects of air pollution on mainly the respiratory system, but noting that we do have effects really going back to fetal life in terms of effects. And I think Ian's going to mention that later. We shouldn't forget about indoor air pollution. Lots of things that are generated inside the home. Outdoor air pollution comes inside the home, of course, but also we're generating things in cooking. And we've had this, our report, the indoor on an indoor air, again, freely available, emphasizes this has effects, and this is just from this. Again, mainly respiratory problems, including wheezing, but also allergy problems. This is a relatively old slide. We try and think about advice, and I think Joe is going to be talking about advice. We need to refine that, and perhaps the new technologies about measuring our own personal exposure or modeling in that in real time may help in us deciding what to do on high air pollution days. We've got some attempts at trying to integrate this to the NHS, and this was a very important part of our recommendation for children and young people, the Asthma Transformation Plan, led by this program, where we expect clinicians and allied health professionals to be able to communicate about air pollution. And this is an example of an air pollution plan that we use and we're testing out in our clinics. In fact, we have a new clinic in London where we are using lots of this instrumentation. And finally, yeah, I mean, it's important, given the strength of the evidence, I personally have been involved in advocacy. We had launched Doctors Against Diesel some time ago. It's less active now because of the ultra low emission zone has done what we asked, is to remove the most polluting vehicles from the road, which are these older diesels. And this is just an infographic about the plan. So yeah, this is a short sort of gallop around the health effects of air pollution. But the conclusions is absolutely the major effects on the breathed environment, on both the development of asthma and the severity of asthma, and a range of other childhood diseases, both in terms of long and short-term exposure, both indoors and outdoors. And I think, you know, we're tasked to advocate the need to detoxify the breathed environment for our children and for the whole population. Thank you very much. I'll just stop. So I'd like to hand over to Joe. Over to you, Joe.
Thanks, Jonathan. Great to be here with you all. I also have some slides to share, so just bear with me a moment. Right, great. Hopefully you can all see that.
Yes.
Great, thanks, Jonathan. Right, yes. Hi everyone. I'm Joe Harrison. I'm a program manager at Global Action Plan, and Global Action Plan are an environmental charity looking at people and planet and trying to encourage people to live healthy and happy lives within the Earth's limits. And lots of our work is around clean air. We do lots of projects and programs around clean air. So that's why I'm particularly here today to talk to you about some of the work we've done around improving air quality in both schools and healthcare settings, in particular around integrated care systems and that kind of area-wide pollution work that can be done via ICSs, and then also, yeah, as I say, in school settings too. And we've got lots of resources and tools which hopefully you will find useful, and I can share links afterwards as well to those. All free to download. I'll go into them in more details, but hopefully, yeah, giving you some practical, resources that can be used in your work. Right, this slide's going to work. Yes. So, I suppose Jonathan's touched on some of this already, but just wanted to give some context to the situation we have in the UK today. So, air pollution causing upwards of 36,000 deaths, over 6 million sick days, and this social cost of 22.6 billion and over 20,000 hospital admissions too. So it is really huge impacts in terms of what air pollution causes in terms of health impacts. And the funding for conditions related to air pollution is much lower than some other things too. So that burden is quite high and the cost is quite high. Jonathan mentioned Ella Deborah, and following the inquest that came after her death, some of the health recommendations that came out of that are here. So thinking about air pollution messages as needing to be tailored to different patient groups, and trying to encourage health professionals as those trusted messengers in society to talk to their patients about air pollution. I suppose get over that severity that we've just seen, and an element of upskilling and needing to work with health professionals so that you can understand these issues and be able to be those trusted messengers and get those things over to patients. So I think that's useful context, as is some of the commitments on air pollution from the Chief Medical Officer, which came out last year, I believe, and one of those is around halving the contribution for air quality within a decade, and with a focus on health inequalities too. There's this big piece that I suppose I've already mentioned around staff training, how to minimise the effects and how to communicate to patients too, and a big push around including air pollution and taking action on air pollution in NHS green plans too. So all hopefully really relevant to the work of the people in the room, and shows the kind of way that it might tie in. And one of our big resources that I want to talk to you about, which again ties in with NHS green plans, is the Integrated Care System Clean Air Framework, which is a nice snappy name. So yeah, this is focused on ICSs and something we've developed at Global Action Plan in the last few years. Trying to think about accepting that health settings and healthcare creates air pollution through operations. So trying to work with healthcare settings and with ICSs to try and minimise those contributions and therefore protect staff and patients and the wider public too. So what is it? It is a framework which is all free online, aimed at ICSs. So that could be anyone within the ICS. And it breaks down the actions that an ICS might be able to take to improve air quality by all these different topics that you can see in the table in the middle. So then within digitalization or transport, there's different actions that staff can work through and then rank around progress. You can see on this dashboard on the right there, there's that framework progress too. So this really breaks things down, gives ICSs things to work through in terms of improving air quality. But it is that kind of long-term picture. We're aware that there are lots of these things are not going to be quick wins that you can do overnight. It might be something like changing transport modes of how people get to and from the healthcare setting. So that takes time to kind of implement and move through. And there's kind of lots of examples and support within the framework to help people within an ICS to do that. And we also want this to be part of kind of all the work that might be going on in the local community around improving air quality. So tying in with stuff that the local authority might be doing. I don't know, maybe there's some local authority representatives, officers on the call too. So thinking about working in collaboration there and local authorities regularly reviewing and assessing air quality and thinking about producing action plans around that. So ensuring that the work that ICSs do is in collaboration with that. And similarly with schools too. So in the Asthma Friendly Schools Guide, there's this piece around ICSs making sure that the support and healthcare is in place. So again, this framework try and tie things together for schools and for the wider community too. And at the moment, we are doing a pilot with 5 ICSs in the southeast around this framework and the actions that they can take to improve air quality. So we are putting it into practice and trying to working with them to kind of learn about how we can improve it and to have some case studies that we can then share around the impact that this framework and the actions that they've taken have had. And that will be coming soon. So keep a lookout for that. And then we will continue to improve the tool based on that feedback too. And as I said at the start, this is one of the tools that is free on our website, and I will post the links later on in this talk so that you have them. But yeah, on the Action for Clean Air website, there's a health section where you have this ICS Clean Air framework alongside lots of other supporting resources, posters such as these, highlighting the wider impacts of air pollution on the body. Excuse me, we've got yeah, this leaflet around air pollution and child health, which again might be useful to some of you, and around kind of simple steps you can take there. And then actually Jonathan already shared part of this, I believe, which is yeah, the air pollution action plan, which is being used in health settings and trying to tally kind of complement an asthma plan with some of the actions there, and allowing young people and families to kind of take that on and think about what they could do to reduce their exposure to air pollution. So that's some of our health resources. I did also want to talk about some of the work we do with schools and how that might be relevant, and some of the resources we have there too. And I suppose starting off here to kind of, again, give a bit of context and situate it. Jonathan's already talked a bit about the situation, but thinking about all schools in the UK are in these areas of high air pollution above safe levels, which unfortunately means that young people are exposed to really high dangerous levels as they go to from school, as we saw in that chart from Jonathan earlier. And children are particularly at risk. Again, this has already been covered. but because they're developing, the systems are developing, and there's areas around physical health and mental health and their ability to learn. And particularly, I suppose, children with existing health conditions such as asthma are more vulnerable to the impacts of air pollution too. And what I want to talk about, I suppose, is that this main point that through improving air quality in school settings, it benefits asthmatic children, but also all other children too. And there's a real kind of return on investment for the school and for the community and for the NHS in taking that wide approach in reducing the burden of ill health. And I suppose to talk a bit about some of the co-benefits of improving air quality in schools is firstly around climate change mitigation. It might be obvious that lots of the causes of air pollution are linked to emissions, and therefore improving air quality, then that helps climate change mitigation. We talked about the children's ability to learn. There's lots of research around the mental health and well-being side of improving air quality. And I've also talked about the strain on healthcare systems and how that can take away from that too. Excuse me. And then more co-benefits. So one of the ones that I particularly like, and I've seen lots of the work that I do with schools, is around this sense of community and improving the environment around a school and in a community through having things like in this first picture, you can see a school street outside the school where they shut the road at drop off and pick up times. And it just provides that nicer space for everyone to chat and play, and creates safer streets as well. And reduces that vehicle usage. It's part of working to improve air quality in a school setting. And when we talk to schools, we think about source reduction and exposure reduction. And source reduction is really key, so reducing the air pollution that we cause. But it is sometimes harder for schools and people in school settings to take those actions. It needs some policy and legislative support. So we do encourage schools to do that where they can, but then there might be things which are more around exposure reduction, particularly maybe on high pollution days, thinking about that, what you do there, thinking about maybe low pollution routes to and from schools, thinking about how people get to and from school in general, or ventilation as well. So that's quite a big focus of some of the work that we do with schools, and there's quite a lot of things schools can do with minimal cost to help with that. And one of the ways that we would encourage schools to do that, or like a tool that schools can use, is the Clean Air for Schools framework. Similar in a way to the ICS framework that I shared previously. This is an online tool free for anyone in the school community to pick up. And it basically works to give them a tailored action plan, again, similar to the ICS framework, that they can work through and take actions that are appropriate for their school setting. So quickly to run through how it works, there's a bit of entering school details, and then there's a short survey at the start which asks a few questions like, is the school near a major road, or are you able to open windows, how do people travel to and from, which helps to pull out recommended actions across these 4 different steps, 4 different pathways, around traffic, around school operations, around education, and around voice, which is kind of the wider community advocacy piece. So that, yeah, it takes 10-15 minutes to complete, and you get a list of actions out of it, and a clean air plan. And this is all based around cost. You can see that maybe you can't, there's little symbols on each of the actions around the impact that action might have positively, the cost and the time that it will take. So it's trying to give you a bit of an idea of that as well. And then there's loads of details to help you to do it in a school setting. So lots of kind of links to how people have done it, to advice, to case studies, to then implement these changes within the school. So that's all online, again, on the Action for Clean Air site. And alongside it, we also have lots of other free resources for schools, whether that be kind of teaching content, education content, or more campaign focused resources. So things around low pollution maps, or around active travel more generally, and things like that. So please do check them out if they're relevant to you. Again, I'll share the links afterwards, but it's on Action for Clean Air. And that's, yeah, lots of, and they're all free. and available for anyone to pick up and use. Finally, I did want to briefly talk around the asthma-friendly schools. We worked with some NHS colleagues around this London Schools Guide for the care of children and young people with asthma, thinking about clean air schools having those benefits for asthmatic individuals, and integrating that framework within that so that schools can, and people in school communities can start working towards those actions, and that being an important part of helping to mitigate some of the effects of asthma and air pollution more generally. So that's another thing to think about, and where I will leave it. Hopefully there's useful tools and resources, and happy to answer any questions at the end, or any reflections people might have, and I will put the links in the chat too. Thank you very much.
Thank you very much, Joe, for that very nice presentation, and certainly Global Action Plan have been very, very helpful, I think, in moving the information that is available that we can use. So well done to you and your organisation. So I'm very pleased now to introduce Ian. He has remarkable insights into the whole of the spectrum of air pollution. So over to you, Ian.
Okay, so now it's the sharing the screen gambit. Stay with me, see how this goes. If somebody could tell me whether they could see this, right. This would make me very happy. Excellent. So let me just get a little pointer up here. I have the value, because I'm speaking last, of being able to reinforce messages that people have introduced beforehand, but also to put some contextualization on this and how we think about the impact of air pollution on asthmatics in the round, in the context of all other hazards which exist within the environment. So the first thing I really wanted to point out, and we've covered this already, is that our knowledge of the impacts of air pollution on health has evolved, but we have known it's bad for health for a very long time. If we think about what we have learned in recent times, which is really significant, it is really the fact that many of the impacts of air pollution are felt very early in life, even pre-birth, and that these have impacts not just in the short term, but in the long term in terms of disease development. So Jonathan mentioned the evidence of smaller lungs. The lung, the smallness of the lung, the actual increment, is relatively small. What is important in that sort of data is that actually what you're seeing is an organ not developing along its normal trajectories, not at adulthood reaching its peak capacity. And that capacity, reaching peak capacity in all organ systems, is a very strong predictor of your longevity, how long you're going to live, and how healthy you're going to be in old age. So the air we breathe when we're young really matters. And that is really a motivation for trying to clean air up now in a shorter possible time. And I can underline this with a few pieces of ancillary data. Jonathan showed data demonstrating that there were combustion-derived particles within the placenta. Well, the next question would be, does that really mean anything? Does it matter? Well, this is a study, and it's a relatively contemporary study. It's an epidemiological study, and these are always retrospective. They're always going to be in the past because the data has to exist. But this is relatively recent data from London between 2006, 2010, and it's looking at around 500,000 live births within the Greater London area. The question it addresses is really simple. Is the air pollution exposure of the mother during pregnancy influencing the birth weight of the child upon birth? And what this is showing is the odds of having a child who has low for term birth weight in relation to the exposure of those children to different types of pollutants. So here again, we have nitrogen dioxide. Here we have PM2.5. But in this study, they've attempted to take that PM2.5 measurement and sort of slice it down into the specific component of PM2.5, which is coming from the exhaust. And what this data shows, and you can simplify the message, is that in London, in the London population between 2006 and 2010, breathing poor air quality, and specifically poor air quality related to urban traffic, was associated with smaller birth weight at term. This is current, this is our contemporary air pollution. So that's something to bear in mind. I spend a lot of time with people telling me that air pollution, we maybe overemphasize it, it's much better than it used to be, and it is true, but it still is having a profound effect on the health of individuals growing up, not just in London, but in cities throughout the United Kingdom. The other piece of data, and this is a very busy slide, but again, the message is quite straightforward, and it's a very powerful piece of data because, again, it's relatively current. This is data from 2009 to 2030, looking at GP consultations for respiratory causes within just Lambeth, just the borough of Lambeth in the centre of London. So what do we have here? We have NO2 concentrations, and this is looking at day-to-day variations in nitrogen dioxide production, and this is the increase in respiratory consultation. So we can just look at this panel here. And what it's telling us is, if you look on the day of a peak in NO2, you see a sudden statistically significant increase in respiratory consultations. But that peak, those consultations go up based on the day before, 2 days before, and are influenced by the week of exposure before that. And these effects are particularly strong in the age group between 0 and 17 years of age. So again, we can see where air pollution is going up. There is an absolutely clear increased demand on primary healthcare services. And buried within here is something really important. It's something I would really like to emphasize in this talk. The current advice we give on high pollution days is to stay indoors, reduce strenuous activity, avoid air pollution hotspots, have your medication with you on that day. You need to be reviewing your symptoms and having your medication and taking precautionary action for at least a week after that air pollution event. It isn't a single day effect. There is a considerable lag in terms of symptoms, and somehow we've got to get this message across into asthma management plans so that people are more aware that even when the air pollution is getting better, there will still be a lingering effect from the air pollution in the preceding days. So I'm very quickly going to do something I very seldom do, which is to move away from all of the really bad health statistics to actually focusing on what is good and what is actually positive about what's going on in the present moment in time. Now, this is a paper, it's a very famous paper from the New England Journal from the Southern Californian Children's Health Study. And it's a bit like the study which Jonathan and I performed in East London in terms of it was looking at children's lung growth and lung volume across time, but they were much more involved in their studies than we were. So they actually have 3 longitudinal cohorts over a long period of time, different epochs, between 1994 and 98, between 1997 and 2001, 2007 and 2011. So these are different waves, different children across time. And here they're looking at the proportion of children with low lung capacity and less than 80%. So these are clinically significant decrements in their lung volume. And what they show is that the number of children with small lungs falls by about half between 94 to 98 to 2007 to 2011. And this is related to the fact that in California, they really regulated air pollution, really with a great degree of political, I think, bravery. It resulted in a reduction in pollution, and that reduction in pollution resulted in better growth trajectories in the children within their communities. If you reduce air pollution, there are clear, quantifiable and measurable benefits to your population now, but those benefits will continue to be felt for decades to come because your population will not be storing up adversity in terms of their overall health. The other thing, which I'm going to describe as good news, but I have to say has caused me quite a lot of grief over the last 4 weeks, is that we finally have ambitious policies to try to do something about air pollution, and specifically air pollution from diesel vehicles in our cities. The ultra-low emission zone is a policy which is specifically attempting to reduce tailpipe emissions by using financial penalties to encourage actually simply the acceleration of vehicle turnover. It wants the population to be transferring towards cleaner vehicles. So this is the nature of it. Now, what's important is it gets you away from the idea of just dealing with little hotspot locations where there's high pollution to realizing that air pollution doesn't have a geographical barrier around it. You want to tackle air pollution, you need to do it on the macro scale. You need very brave, citywide, actually national programs of work to make a significant difference in air pollution. And even as this has just been extended out to the entirety of London, and that's caused quite a political kickback, people are saying it's had no effect. Well, this is the effect it's had. This line here are concentrations of roadside nitrogen dioxide. Again, nitrogen dioxide as a proxy measure of everything which comes out of the exhaust of a diesel vehicle. And what you can see is following the introduction of the ultra-low emission zone, we see a significant, I mean, this is a huge reduction in NO2 within that central zone where the ULEZ was initially introduced. This is an unmitigated success story, yes? And yet somehow the success story is being confused, discussed, dissembled within the population. And as the extension has happened into and after London, we now have really large political movements occurring, actually attempting to disprove the evidence, A, that there have been any pollution changes at all, despite the fact that the data's publicly available, has been reviewed, is very, very clear, but also questioning the underlying 50 years of science linking air pollution from traffic to respiratory health. So we're in a really strange position at this present moment in time, where I think all of us who work in healthcare or at the interface and public have to be very proactive in being out there to ensure that the truth, or at least the evidence, just the evidence, the raw evidence is being presented to the public, because we now have active players who are presenting falsehoods to the population. And we have to deal with that, and we have to be brave. And certainly doctors against evil have been very, very proactive in supporting these policies and vocal in calling people out when they've been attempting to sort of dissemble the truth. The other thing I'd point out is that we still have a problem. Even with all of our traffic measures, we have a problem. These are the most recent maps we've produced of PM 2.5 and NO2 concentrations across the entirety of the United Kingdom. And here we have the scales, and these scales are annual concentrations from 2 down to 40 for NO2. The little hotspots are all cities. Urban areas have air pollution problems, of course they do, but we have to put this into some sort of context, and to do that we have to understand what the guideline levels are in terms of protecting human health. So look at this map and you'll see that most of this map is blue, and it's certainly around 5, 10, 20 micrograms per meter cubed. The reason I'm saying this is those guidelines changed, and they changed in September 2021 when the WHO updated its air quality advice to international governments in terms of their own legal target setting. And what I have here is just the most recent advice. Now, let's focus again on NO2. NO2, the old British limit value and EU limit value was 40. The success of the ULEZ has brought it down in inner London at roadsides down to about 20. But actually, the evidence from the WHO has reduced the guideline, the suggestion that's given to governments, down to 10. Now, if you use that 10 value, literally every populated area within the United Kingdom is non-compliant with that guideline concentration. And it's the same thing with PM 2.5. PM 2.5, the old WHO guideline was 10, it's been halved. So even though air pollution is improving, the weight of evidence is demonstrating that we have to go further. We have to continue the pressure to reduce air pollution. And if we do, we will still see health benefits. And economically, those health benefits will still be beneficial. Now, a few other things, and I'm thinking about this purely from the perspective of the advice we give to individuals about air pollution. And I think some of it we have to be a bit careful about. One of the things which makes me incredibly angry is when I see schools near roads, which in an attempt to reduce the air pollution have planted silver birch trees next to them. Silver birch trees are highly allergenic, they're hermaphroditic, all of them produce pollen. We really need to be very careful in our urban environments about what we plant and where we plant it. And we have to think about that when we're giving advice about air pollution. If we're going to think about green solutions to air pollution, we have to pick the right plants in the right locations. At the present moment in time, we are clearly not doing that. And we could be in a situation where actually we reduce one risk and replace it with another. And certainly I would have thought the type of vegetation planted around schools should definitely be part of any advice given to a school in terms of achieving an asthma-friendly criteria. It's something which has been neglected, and I think it's something we really need to pick up going forward. The other thing which is important, again, this takes us back to the guideline where it says, if you're going to do exercise, think about doing it indoors. Well, you know, indoors isn't a great environment for many people in the United Kingdom. If you look at the deprived housing stock within the United Kingdom and the potential problems we have within those environments, and this is just an illustration of mole, then we have to be very careful again about making sure that we consider indoor exposure risk in the context of outdoor exposure risk. We need to think about the total breathed environment, not just the ambient environment, if you're going to give informed and sensible advice to individuals with asthma. And indeed, even in houses where there is mold, we have to make sure we give them sensible advice about what to do about it. I mean, the idea that it's a great idea to get bleach and to mop down the walls with bleach whilst you have an individual who might actually be sensitive to those emissions and those fumes needs to be thought about. So we have two things we mustn't lose sight of. And then there's a final thing which I think is important, because as happy as we should all be that the ultra low emission zone is occurring, that it is having very profound effects on tailpipe emissions from diesel vehicles and from gasoline powered vehicles. Cars don't just make pollution from their tailpipe. We get considerable pollution from tire wear and from brake wear. And at the present moment in time, we really don't have a good handle on how those pollution sources, which will be within PM 2.5, contribute to the worsening of asthma. And so when we think about traffic, we need to begin to assume that there needs to be greater focus on these non-exhaust sources, because as we move towards net zero and the electrification of the fleet, this is going to become a much more dominant source of pollution in the population and something which needs a little bit more of our attention. Guess what? I'm going to suggest you read the same things everybody else has suggested you're going to read. The Chief Medical Officer's report is particularly good on indoor air pollution sources and on mitigation policies. And that's it. Thank you very much.
Thank you very much indeed, Ian. And so we're now open for questions. I have on my phone some of the questions, which we'll try and answer very briefly so we can get through those questions. I think the first question was really translating about what we know in the NHS to actual changing UK development policy. Is how can we do that? Ian or Joe, can you, I mean, what do you think? Do we have any say apart from as just ordinary voters, or as, you know, just advocating to the media? I mean, are there any routes that we can use to influence policy, especially about new developments? Ian, are you
presently? I'm please jump in if you disagree with me. I'm going to say no. I'm going to say we have no real tools other than public advocacy, but we might have had if Ella's Law had gone through, which would have introduced the right to clean air as a right, which would have meant it needed to be considered in planning decisions and in infrastructure decisions. So I think we're behind. I was actually in Parliament yesterday talking about brownfield site developments, and quite frankly, the planning situation in the United Kingdom and the deregulatory climate we're beginning to see around brownfield site redevelopment and redevelopment in general, I think is potentially dangerous. I think we have to be extremely cautious in this area. I'm very concerned that we are stumbling towards building cheap, affordable housing for individuals in suboptimal environments, which will have long-term impacts on their health. But are there things we can do? All we can do is speak to people, I think, at this point in time, and as voters, vote.
Yeah, and Joe, I'm presumably you do lobby, I guess, or maybe you don't.
Yeah, we've been doing some advocacy work, but yeah, I know. I mean, I think Ian's covered it there. I think that's a very good answer, and I think it is just speaking up and hopefully using this knowledge, that maybe some newer knowledge that you've gathered today, or knowledge that you have already, to share that, because I think it is still, people aren't aware of lots of these issues, so I think it can still spread more. And then well, there is some advocacy work behind the scenes that we're all trying to do too.
Okay, we'll carry on. And the question is about waste incinerators. Perhaps I can answer that. As far as I know from the reports, the modern waste incinerators don't emit very many particles of nitrogen dioxide. But what is perhaps missed in the reports are the traffic, the traffic associated with those. I don't know, Ian, is that reasonable, that we can't just think about what's emitted, but what actually the emission profile of people who are living around there is perhaps more important?
I think actually it almost goes back. This is about point sources, really. It doesn't matter if it's a brownfield site, a factory, an incinerator, a landfill site. Yes. The problem is, if you're trying to look at the impact of those on health using what I would regard as being our criterion pollutants, PM 2.5, they will make a relatively small contribution to that mass, and it'd be very difficult. And that's what the reports all show, to show that they have an additive effect over and above what you see in the background. What we need to do is to move beyond those simple measures of pollution to actually measuring unique chemical signatures from incinerators or from these other point sources, which should allow us to link their emissions specifically to health. And we're not there yet. We're still doing very antiquated approaches, which are almost doomed to not show effects because of the range of sources we have within our urban environments.
Yeah. I mean, I think there's a general point that actually our estimate of personal exposure in epidemiological studies is an estimate, and almost that tends to reduce, and usually tends to reduce the size of effect that you find due to exposure misclassification. But your other point is that are all particles equal? We won't go into that question today, because we also have something we didn't talk about with secondary particles, which are often from agriculture, but they're not pure particles because they pick up other things on the way transported. So it's immensely complicated. But the take-home message is the epidemiological studies, merging all those things with all their limitations, are extremely robust across populations. There's a question a bit about smartphones. Joe, maybe you've got a measure about that. We've been using we have a trial of smartphones. You can imagine, smart inhalers and smart technology. You might imagine if there's a high pollution day, it would say double your inhaled steroids for 4 or 5 days. I mean, that's not part of the recommendation yet. Have you considered that in your feedback?
Was that to me, Jonathan? Sorry. Yeah.
Well, I just wondered, whether you've had any signal about what people do about their treatment, and if they'd had better recommendations, more definitive recommendations, that would be helpful.
Yeah, I think, and you mentioned the alerts there. I think they can play a really big role, and I know there are the GLA are looking at the alerts that they send out in London to school and healthcare settings, and looking at updating them so that they have clearer advice. I suppose they might not be to that level of specifying around particular conditions, but at least would be more pointed in the advice that they give. So I think that's in the work. And I think there in general, I know there's a question around monitoring and trying to measure things yourself as well. And I think that monitoring side does play a big role in that. If we all know what's going on and what the levels are, then we can all take more action. So I think generally supportive of any monitoring solutions that are out there and that have been rigorously kind of tested and researched too.
That's very useful. I mean, in fact, that comes into a couple of other questions about what we think the most exciting area is, and secondly, about the feedback of personal, personalized information related to your own exposure. It's a bit. I think it's fair to say, Ian, that we're not there yet for sort of wearable devices, which will tell you exactly what you're exposed. But almost certainly, organizations such as Google know what is going on any road at any one time, and surely it would probably be quite possible to link that to some sort of dispersion model in real time, which will give you some idea of what you're exposed to. Is that a pie in the sky?
No, it's not a pie in the sky, but what I think we have to be careful is that everybody's responses are individual. Yes, and so everybody has their own dose response curve in terms of their symptoms in relation to what they're breathing. And what I think we need to do is to develop apps built on that exposure information, where people can actually log their own symptomatic responses, so they can determine which levels of air pollution or which days and which exposures are the ones which cause them challenges on that given day. I think we're pretty close. Sometimes I think we can get a bit too tech happy. Most of us who've done walks with these sensors around cities very often end up realizing that when you're near a busy road, it's quite high, and when you're further away from the busy road, it's lower. And then you have your eyes, which are effectively good sensors of telling you in a high pollution or low pollution environment. So I don't think everybody has to have a sensor. I do think we can use sensor information to give better advice, but I do think people who have particular vulnerabilities and sensitivities need to know their own levels of exposure which trigger their effects. And again, I think that needs to be built into their actual asthma plan, as opposed to being something which is separate from it.
Yeah, I think so. And I mean, you can imagine big data, if people agreed, all of that data could be then entered into a much larger data set, which give us insight into that. One very quick question while I've got you, Ian, what trees should we plant?
Anything which isn't a pioneer species like silver birch, traditional old English trees. And it's not just actually the pollen from these trees. Some of the more exotic plants we plant in our cities are significant emitters of volatile organic carbon, which contribute significantly to those secondary pollutant aerosols. And in places like Beijing, where they've had urban greening, they're now having significant problems with secondary organic compounds, because that plus climate change means that you're creating a new emission source. But there are an entire list, there are books which will tell you about plants, their VOC emission rates, the antigenicity of their pollen. And so actually it should be quite possible for councils and government to have policies to plant the right plants for health and not the wrong plants.
I think you might have to be an expert then. I mean, that's another area of expertise you're going to have to develop pretty quickly. As someone suffers from birch pollen allergy, I totally agree. It's not a good idea to be allergic. The one question the final question which I perhaps ask is advice. A lot of advice is related to mitigating exercise, and that's a bit of distinct from the advice related to obesity and healthy living in general. I should say that there's an ongoing consultation, extensive consultation. Met Office is involved in that, and the health and safety, whatever part of government is involved in reviewing that advice. But clearly, it needs to be passed a little bit better, that we don't saying that you're not to exercise. It probably should be related to severe strenuous exercise outside rather than no exercise. So I think that message needs to be adjusted somewhat. So yeah, we've reached the end. We're now a minute to go. So thank you for staying with us. I'd like to thank the two other speakers and thank you for Ask Asthma to invite us and allow us to talk. We're very happy to engage with you, and if you want us to speak, I'm sure you can drop us a line in the future. So thank you very much, and goodbye, and have a good weekend. Bye.
Thanks everyone. Thanks, Jonathan.